So first, this is just the beginnings of our, essentially a beginner's routine, but I'm going to be sprinkling in a touch more from even the prior video. Ideally, we'll have a slightly better angle with mirror and all that. Beginning with our list of methods, which can be found in the book and all that, what we have, and these can follow a nice pattern of even how you learn them and how often you tend to use them. Resting, as well as, oscillation would incorporate elements of rocking, but I tend to not just rest entirely, right? We need to initially come into a space. This would be a dynamic where we've met the client, done some assessment, looked at the paperwork, had them show movements or whatever, dialogue on what their goals are. He has indicated, and we saw some asymmetry related to his right shoulder and scapula and his left hip. The symptoms that this client was talking about was related more to right shoulder and then low back. And now even immediately as I palpate, just like anything we've talked about with draping and just learning your protocol, you come in, we want to make sure the bolster's in place. We got that already in there. It has to be number one. But since I'm standing here, rather than just breaking contact, right? I have to come in the room, get that bolster set, and then let's start with our resting associated applications. And that's where I just grab the heels. I usually get this set, and then what I'm doing at the same time is confirming that the bolster is at where I want it to be relative to their ankles. I want, when I find their heels or their calcaneuses, the bolster to at least be in line with that. I might even want it a little bit more scooted down. There. I want to be able to essentially have my hands resting here, come over and touch at least the edge of the bolster. That tells me that the top of their foot is resting against this and is supported. And I can visually see that these days and feel it based on how floaty their feet are. But resting here with a little bit of rocking, but rhythmic and slow, right? I don't go. This should be pretty common sense of like how you would do this, because it would feel odd to you to, right? So slow but confident and relatively firm touch, right? You're starting out and you're nervous. Don't be so light and delicate. That's reads to a person's body. It's like, yeah, if you're scared, it's scared touch, right? So contact, we're not applying a lot of force, but squeeze a little bit, a little rock, work my way up. And along the way, I'm feeling and assessing, right? Tone, more or less symmetrical. Okay, not a big water balloon behind his knees. Okay, working my way up. Gotta watch with open palm around the pelvis, of course. So there I kind of skip, hand to the low back. Now I'm finding the spine, feeling where the sacrum is. It's usually really easy to find because you can kind of identify where the pelvis starts with the uphill element here. Application, there's the sacrum, here's the lumbar spine. I'm kind of doing more what I usually do. It's like here, here, okay, hamstrings, all right, tone, symmetrical, here, here, then a swap. So I go from like sacrum to low thoracic to lumbar, high thoracic. All right, and it's just patterned in. So almost every time anybody gets on the table, they feel this as the beginning set of applications. So this can be a conditioned response. And along the way, as opposed to me just doing it as a series of resting and rocking based applications, I'm also feeling and observing so I can assess what's going on. And little things that I have felt. The tone is increased here on the left lumbar area. The scapula is more winged out. It's elevated and protracted over here on the right side. Just real fast. Now that'll take a little while for you to identify that quickly, but it's like right there, I can already have a sense of, yep, that makes sense. you have a right shoulder thing and some low back issues. The two are probably connected. Coming around to the head of the table, all this over the sheet, feeling, and when I'm on both sides like this, it's hard when you're standing on one side of the table, but here is where you can stand and have pretty even amounts of how much pressure you're using from one hand to the other. So judging the tone you feel. Now I can start to turn this into what feels a bit like massage, right? This is where we watch. It's not a glide, it's a compression with a bit of a direction. Just a static hold or just a static compression is boring. It doesn't have as much, it's not creating as much stress into the tissue, thus it's not going to feel as much like there's a sensation doing something good. So it's usually going to be rest with a rock or a compression, plus it's not a glide because we're not really skating across the tissue, but we are pushing the tissue in a particular direction. And then I just get to go, well, stuff between the shoulder blades and up at the shoulders feels good to get worked on, right? It can be light pressure, but I'm also just feeling the tone. And this is where body mechanics wise, this is kind of going to be my best initial showing for how to move your whole body all the time. Moving your whole body, not just your arms. And that's going to be a challenge. It runs counterintuitive. Most people want to do this. Maybe they'll stand and they'll do this, this. That would all be wrong. So I'm going to use my body weight so that I'm lined up. My head, my sternum, meaning my thorax, my belly, my pelvis, everything. So that my toes ideally have to be pointed forward so that everything is falling forward right where I'm contacting. I want my body weight to be doing as much the work for me, not my arm strength. So that's where just a lot of real small shuffling footwork. And I think you've experienced just how unnatural this initially feels to do, because it's just this. Making that graceful is unique, but it comes. But rather than me here, again, watching the footwork, not my hands, because this is just going to stay perfectly static. My upper body should ideally look like it's not changing at all. The sense of movement is occurring through my forward knee. My core is stable. And I'm letting my body weight change. Once you see how when my foot picks up, that's when the most amount of pressure is being applied. So I create this light contact to deep, light, deep. So switching my feet, not standing usually perfectly in line. There's a lot of like starting in one spot, and I think of creating little crescent shapes. And I kind of have this area to work on. So over here, I keep walking until I've made a crescent. And then there's a point where that starts to not work for my wrist. And that's when I switch. And there you go. And this feels good. It's a great place to start some initial applications. This is how we can do a little bit more here between the scapulas than is just that forearm thing that I started to show you. Also, really easy assessment. I'm putting my hands on the scapulas, and I had one floating around out there somewhere, but I don't see it, and that's okay. But just visualizing on skeleton. This skeleton has very flat, flush scapulas. If I'm looking for the inferior angle versus the superior angle, that's the medial border versus the lateral border. In this projection here is the spine. Now, it starts off being much easier to just find the inferior angles and the medial borders, especially if a person has what we call like winged scapulas. Once I find those, so my middle fingers are gonna go right on those inferior angles, my thumbs are gonna sit on the medial borders, and I just stare at my hands. I do that ideally with a way that doesn't also not feel like massage. It gets faster and quicker where I'm here, this stuff. Some of the sneaky parts here is I'm making sure the shoulders are flush on the table, and then I can get an accurate read. So that I'm making sure they're not just, for some reason, laying crooked. And make sure they're, And then this is what I see. This hand is higher up and further over. And then eventually you'll know what muscles do that. The classic one would be stuff up here, upper trapezius and levator scapula would elevate the scapula. So if those are short, they'll pull the scapula in that direction, and that would be what I would find. And the other one that we saw with our physical assessment was that there was an exaggerated seam across the front of that right shoulder. That would tell me that the pecs are short. So right off the bat, from pre-assessment to on-table assessment, I have determined that if we at least focus on upper trapezius, levator scapula, pec major, pec minor, we'll do something positive for this shoulder orientation. And the rest might just be a good general application everywhere else. With the low back, we'll identify, hey, there's probably a variety of things going on here. I will make sure I work on that really good in prone and sideline, and then a little bit also in supine, and then we'll see how miraculous that is. But I've been able to be a bit more targeted here, and I'm going to be a bit more general here. Okay. So that's one more all around. Here, then we're just going to go right into real time. Looking for how well the pelvis moves. If I moved this area of the body and the whole body rocked back and forth, or it felt really hard to do, that would tell me maybe there's something up with the lumbar vertebrae because they're not allowing the pivot action to occur. Here, looking at the scapulas, doing something where I'm confirming symmetrical tone, but also just doing stuff that starts the massage application and feels good. Deciding which side of the body I want to start on. And I'm like, okay, in this case, the low back is it's more toned on the left, but the right shoulder is the goal. So I'm gonna go, all right, I wanna make sure I get to this shoulder last-ish in this orientation. I would prefer to assess. I would like to assess the left and compare it to the right. But I'm in a little bit of a catch-22, right? Whereas one versus the other of this low back versus that one. But that's okay. Whatever the client's goal is. All right. Now we start our draping, which is, I've told you, stay bunchy. This is a way where I can even just use that, keep that arm covered. Bunch, bunch, bunch. Now, easiest thing to do in order to allow myself to have better body mechanics in this whole area, the lumbar and the lower thoracic area, is to allow myself to get closer to the table while avoiding inadvertent contact with the client's arm. And that's something we should always be aware of too, is inadvertent contact with their hand and arm. So be aware where their body is and where your body is. And so just get it out of the way if we can. Voila. There's one option. I confirm that that's comfortable. Is that okay to put the shoulder there? Can we bring it all the way up here? Is that okay? Cool. Now, here what we have is an example of that hydraulic stool, although this one's a little broken. I could offer this to a client to just rest arm on. Now, that's the best thing I can ever show anyone. Now, assessment-wise, that also, even though we didn't do a lot of initial movement-based assessment pre getting the client on the table, so not a lot of active movement pre-assessment. This tells me if a person can get their shoulder beyond 90 degrees in both abduction and flexion. The ball and socket joint, the glenohumeral joint, is probably more or less okay. So it's a nice, quick little assessment strategy with stuff like this too. Now I'm going to start. Now Logan, like me, has a very strong histamine response, so he's a person you would have to not be worried about how red they get, okay? Sometimes what you would want to think is that if you create a very exaggerated histamine response, that usually means it's time to move on, like you've done enough. Now, he would be, and I would be, a unique case where an exaggerated histamine response usually doesn't really mean anything. Just very fair skinned. All right, now doing some applications without any lotion. They're lighter applications, but watching the footwork of how I'm able to just kind of navigate, and I'm trying to move as much of the skin as possible. I'm assessing and feeling for how that superficial fascia is doing. But note that it's not especially delicate, right? I'm not here and then just there. Like I'm really not applying a lot of pressure down, but I need a lot of drag. So that's the term there for one of the modifiers. Drag, no lotion, you will have the most amount of drag. So I try to just stick to him, and then if you see the angle of my shoulder, I'm not applying much force down. So if I hold this for long enough, I could call that myofascial release. But I just have to wait. Now, first thing related to comfort of client is how much lotion. So as I am doing this, I'm going to check in with him whether or not the more drag-based sensation is comfortable or not. So, Logan, just checking in related. We're going to check in how much lotion is best for you and pressure here in a bit. Is this more burny, stretchy sensation feel good, or would you want more lotion?
Good.
Okay, so at least know now I'm going to need some so that I'm not, so I can move along faster. But I've confirmed this client likes more drag, so I can use less lotion. Okay, good. And that means when I go to apply lotion, I'm only going to do a little bit, looking for just enough to start being able to create appropriate glides. Now this is where if I do any kind of like two-hand long sweepy things that look like traditional Swedish or classical massage, this is where I do it. But again, look at that footwork. It's a miracle. Here, here. I don't stand in one place and try to make this all happen, okay? Rather than one, I turn it into two. This is where the rocking element as a cohesive part of the massage. From here to here. This is how you can make, instead of one long stroke, 2 or 3 strokes still very rhythmic. I'm creating more of this rocking effect as I do that. All right, I'll need a little bit more. To each their own on how they apply. I tend to be a little bit of both, where I'll try to apply lotion or cream on the regions, plural, that I'm going to work on, and then a little bit on the part of my body that I'm going to use predominantly. And we're going to switch to forearms here. Now, thinking about the anatomy a bit, let me turn our skeleton prone. Just, there it is. I have to try to just forever cement in the shape of the iliac crest of the pelvis. It has that big arc. And I want to be adjacent to it, but not smash into it. Now it'll get easier over time. When I get myself set, this arm is just resting somewhere that I think might feel nice, but forever my working arm, the one that's actually doing the work, is going to be the foot that's forward. So right forearm is the one doing the work, and my left arm is going to rest somewhere that either helps me do this application, but more importantly, it's for my body mechanics. It's so that I'm feeling more supported and my shoulders are square. All right. Now we always have to work superficial to deep. So these first few applications are going to be a little bit faster, but they're lighter pressure. I just did 2, so 1 and 2. And now I'm going to check in with client as I change my elbow angle. What's happening here is I did glide, glide. Now I'm going to slow down and increase my elbow angle as I sink in deeper and ask the client to tell me when the pressure is just perfect. But a lot of times when I'm increasing my pressure, what's really happening, this is an exaggeration, is this. I'm dropping my body weight further, but I'm also maybe angling my elbow slightly more so that this portion of my forearm is being more focused. So it's, do I try to stay broad and use half my forearm, or do I get closer to using just a third or a quarter? So starting at the elbow here, not right here. It'll be on a teeter-totter. Gotta be closer to the elbow, not this, this. All right, anytime when the pressure is just perfect. Okay, fair amount of pressure. We're probably in the 40-ish pounds kind of territory. Now while here, again, I can be perfectly static, but that would be kind of boring. Now in order for it to not be 100% static, all I do is kind of shift my stance around a little bit and try to maintain the pressure, but then if you watch, I'm not moving my shoulder, I'm trying to move my whole body to create an effect. So now it would be hard to see, but now there's a bit more of a direction and tension force being coupled with that compression. Not much of a glide happening. And here. And that pressure's still good, or you would want a little bit more? Okay. A little bit less? That's good. A little bit less, okay. So prompting. Don't expect people, more often than not, they'll just be like, yeah, that's okay, that's good. And so you gotta prompt both. A little bit more, a little bit less. Once you say the words, almost always they'll finally give you the honest response. Now starting out, you're just gonna have to check in much more regularly with people in more body areas. In time, I can start confirming, okay, how much does it feel like I'm denting, let's say, the muscle tissue? And I can start gauging this client, like universally, about that much pressure in each area. Some areas are thicker, some areas are less thick. So there we go. Now I'm here. This is the way I do stuff, is I'll get myself kind of set. The way the arm is oriented, though, makes it harder to work in this upper traplevator scapular. So I'm going to go, all right, we're going to move your arm off to the side real quick. Here we go. Voila. Okay. Now we already did some applications over the sheet. So this area has been already warmed up a bit. And then I'm kind of, right there was me increasing the elbow angle to get a little bit more targeted. The body's not, made of squares. It's rounded, right? So if I want to be more on the upper trap levator scap area, that spot that everybody wants, kind of that classic thumb application to occur, that's up here. So I'm not getting it when I'm like this, right? I have to step further back, increase my elbow angle, and now I'm making contact with it. So there. And a little step. There's a glide kind of happening. I mean, he can feel it, but it's hard to see. And then a little step. And a little step. These are how I kind of make the glide continue to occur. Sometimes it's even just like a little bit of a back and forth. Now I'm really like exaggerating, being slow, because I want you guys to learn how to be slow. The slower you are, the better it is for your body, because you're setting yourself up and then you're mostly just holding. You're isometrically holding. And what you should be worrying about more is like just your core. Like if I think about anything here, I try to get myself set up good and symmetrical, okay, shoulder lined up, elbow straight, My point of application is lined up with one side of my chest. And then if I think about anything, I try to kick my core on and my glute. Are you chilly at all? Okay. And I'm gonna need a little bit more lotion here. There we go. A little bit too much. Here's where the swoopies can come in. Now, applications in this direction. We saw how well that transitions from here to them being right here. This palm is closer to the shoulder, so I'm going to use that one for stuff closer to the shoulder. The muscles there would be more deltoid. So posterior deltoid, excuse me, and then working my way to the triceps. Then we'll take the arm down here. The thing to be cautious of is the medial aspect of the arm. Between the triceps and the biceps on the medial side of that arm is where the main nerve and artery run. So I can work on the triceps in this position, but I cannot put myself in a spot where I'm doing something like this. That's how you would end up on that. You're safest here. He's longer limbed though, so what I'm cautious of is that I'm putting the middle of his arm right into the edge of the table. Somebody whose elbow would be tucked against the edge, I wouldn't be worried about as much. But him, maybe I do something like this. Yeah, let's do that one. How I can support. So I support his arm while also limiting the ability for the arm to slide. If I pick which arm to support the arm in this position, I pick the one closer to their head, because that way they won't slip up. And then here we go. And then that's two directions on the triceps. Ones that went across, you know, more bends / torsions. And then this is a traditional glide, so that will elongate the tissue via putting tension forces into it. Little spots there. Now I'm going to spend forever on all of it because I'm sure, like anything, you ideally learn what are the activities a person is regularly doing. So like with an athlete, the number one thing you have to do is like learn something about the sport itself, and then for each position in that sport, if there's a unique position, what are the specific movements that a person is regularly doing in that, right? Well, in massage, I certainly know we're mostly here, so we tend to get tighter triceps. The lower head of the tricep for massage therapists, I know, tends to get tight. Forearms. He feels like he's doing okay there, not overusing the hands, but other therapists or cosmetologists, mechanics, basically everybody needs their arms worked on more. Now thinking about the shape of the muscles of the limbs tend to follow the skeleton. So there tend to be tubes that run more perpendicular to the skeleton. Thus, you can pretty much always think, now other muscles that are strangely shaped, it gets a little bit harder, but I'm thinking about, do I massage with the grain, which is going to elongate, or do I go against the grain, which will bend or twist? Starting out, more superficially, I'll use kneads to kind of warm surface stuff up, and then I'll work a little bit deeper. Here, in order to create the knead, instead of doing it like this, I just grab around the wrist. I'm not here at the hand. I'm holding on to the radius and the ulna, and I'm pivoting those just slightly. These actions don't have to be huge. That's one thing too. Like the knee doesn't have to be a whoa, right? These can be pretty small and deliberate. And that's not a big pronation action. I'm putting the wrist through. But that allows me, based on where I know stuff hides, because I know deep underneath these muscles, and I'm not going to push so deep to be directly manipulating it. What I'm doing is I'm trying to take this group of muscles and push them off of a muscle called pronator, give them a bit of a smash, but push them in a direction away from it, and then shear that pronator underneath. And that will ideally unstick the two of those. People get stuck in pronation. So they need to get open back up into supination. But this is a way where I can create a torsion and shear stress, but I'm not doing what people think of as a traditional need. I'm doing what is pretty much a glide and a compression, plus rotating part of the body underneath. All right, switching feet, here we go. A place where I can cheat, going downhill, is here. I just like it because issues related to the elbow tend to be lateral or medial epicondylitis. That's golfers and tennis elbow. This pulls the tissues away from that, and when people have issues related to the wrist, this is all tendons here, so usually that needs to be given some slack. So if I pick a really solid go-to for all elbow wrist things, tends to be get really good at finding a way to apply some kind of bend and torsion force here to unstick, because there's a lot of layers here. Everybody's a Popeye, you know? Then here, this is the one place where instead of standing like this, everywhere else in the body, you'll see me standing with my pelvis kind of open to the table, working uphill. This is the one cheat, the one place where I say it's okay to not do that, because now I'm not crooked. All right. Then if I wanted to incorporate any variety of actions, then I just have him do every action you could do. There's a good video on this called More Efficient, More Effective, where I use like all those muscle models and go more in depth. But I can say, okay, make a fist, good, hold. Now if we're gonna start getting into muscle energy technique territory, gotta coach people to hold the contractions for longer, ideally 10 seconds. And slowly, hear my words, slowly relax. We're trying to teach muscles how to more efficiently, eccentrically lengthen. More efficiently, eccentrically lengthen. And relax. Good. And then you know you're doing good work, and when you need to start reducing your pressure, when those fingers start curling, fingers open, it's because I'm compressing the muscles, thus creating slack on those tendons. And as I move towards the tendons, those fingers are going to start to curl. That's why I need to reduce my pressure. Don't crush the carpal tunnel. The tendons do not need to be smashed, they need to be sheared. So instead of standing like this, see how that would smash them down into, versus this. It's a tiny angle choice, not this, this. Okay. Little hack for opening their hands so I can get my soft fist there. I just squash up here, that opens the fingers, and I'm here. Now for some of you, soft fist has worked okay. I'll show the other option of what to do using your palms. I am taking these fingers, wrapping them around the thumb onto the opposite side of the thenar group. So I'm over here with my fingers like this, just supporting that thumb joint and creating some counter pressure for this group of muscles, and then using the soft fist to work. If I'm doing anything, I'm kind of visualizing the metacarpals and trying to work along each one. So I have my fist lined up with that long bone, and then that long bone, and that long bone. And that's going to create shear forces between those bones, and the muscles between them will be affected. What it ends up looking like is that. If soft fist is problematic, then we can incorporate ideas like this just using our palm. Let your fingers go around the thumb, they're just going to rest. And this is a thing that can be used in many areas where I have my fingers curled around something, but I'm not using my fingers to create the pressure. I have my fingers there to catch the tissue as I push into it with my palm. So my palm is doing the work and my fingers are catching the tissue, okay? So see how that, I lift, but the pull is predominantly happening from here, not here. So, there. For me, it's not as precise, but it can feel really good. And as somebody, maybe the knuckles and the soft fist seem too aggressive, then this is certainly an option. I will show you both of those. I like this better for me. I know you like this one, and that's okay. And done. Reset. Oh, no, he was more comfortable there. So I did that wrong. When putting their arm back under, just use their wrist. You can find the table there, set the wrist. That way you're not like completely taking the sheet away. I just find the table, set their hand, then I can straighten the elbow underneath the sheet. Here, swoop around. There are advantages to using the sheet to help you not slip. Now, if I wanted to be more aggressive here, not slipping, well, actually, like I'll be able to hold that tension for longer. Whereas if I had a lot of lotion doing this, I'm just going to kind of pull across. This action might feel more soothing and relaxing to just kind of do these. But it's not going to have as much intensity because I'm not targeting a particular area for as long a period of time. My body mechanics with this, arm straight, and just let your butt do the work. Bend both knees. You're just falling backward. Don't actually fall backward. So I can do this for a glide. That's more going to be more gentle. Or put the sheet there. Now I won't slip. And that's going to be one heck of a, more like a myofascial kind of stretchy experience. And this isn't the shoulder that was asked to be focused on. But what I want to do as the therapist is be sure to work here really good so I can compare the right one. There. Here. A couple long swoopies. So set. Yeah. I'll continue to try to talk, but I also want to stop myself from being too distracted, so you'll see a little bit more like in real time. So left foot forward, staying more light in my pressure, making sure everything's warmed up. Now I'm going to increase my elbow angle. As I've gotten closer to the spine, there's more muscles closer to the spine, so that's where if I'm going to apply more pressure on their back and prone, that's where people are going to want more pressure. And it'll take you a little while to get confident there. Like I'm not applying any pressure directly on the spine. And then as I increase that elbow angle, I'm going to be more on the erector spinae. All right, pressure. And then a little bit more, a little bit less. Okay. There we go. Hold that for a little while. Relax my wrist. It's a little bit, it's always discordant for me in the teaching process because when I work, like I usually have my eyes closed and I'm just in training on their body, their breathing, and the music. Whatever music you pick, you're both going to entrain to it, right? So I'm not a big fan of trying to tell people just starting out, just, feel their biorhythms and their aura and train on their breathing and try to follow that pacing. That's just too much for anybody to try to establish. We will all synchronize our biorhythms typically to the music that we're listening to. So picking soothing music that you both actually ideally like listening to can help a lot with the entrainment processes. Pressure's still good. emphasize how boring to watch this is, but how much better it feels. It's just the right amount of lotion where it feels like you got a touch of that myofascial drag sensation occurring, but slow enough where it feels like each area gets that long duration of compression where it feels like something's actually happening. We can all think on like when you've laid in a massage chair or gotten a massage and you wish somebody would just stay on that particular area, right? You found the thing that kind of recreates what clearly is associated with my symptoms. The response isn't usually, punch it a million times. It's squash it and stay there. And I did that all wrong. I had his arm down to the side while I did all his applications and then repositioned it. This is where my distraction came into play. You can totally, you just saw me navigate very easily with the arm down on the side of the table. It's not that big of a deal. For anybody concerned, and for better or worse, male therapists do have to be more cautious in this territory. That's not me mostly talking to obviously everybody here, but more to anybody on the camera. I just got approached related to a think tank about helping prepare male therapists so that their applications and sessions aren't as likely to kind of get misconstrued. So I was like, well, that's kind of brewing in my brain a little bit if it hadn't always been, right? So some of these things are related to that, of like a more targeted reasoning for avoiding accidental contact, like just bumping your knee into their hand, like stuff like that. Really, you would think anybody of a reasonable mind would not find a way to misconstrue that as an inappropriate action. But don't underestimate people's ability to be crazy, right? So you have to be just, especially with first-time clients, you are well suited to just be more cautious, to drape much more modestly, to work on sensitive areas if you have to over the sheet, all of that. Before you clearly determine, one, are they gonna actually continue to seek care so we can get real improvement anyway? And two, you're confirming that they're not crazy. So once you build that relationship and trust, then you don't have to be quite as worried. It's the first session or two where you have to kind of be a little bit more mindful of that kind of stuff. All right, switch, arm above, holding. Now, table's a touch low for me. If anybody heard me talk last week, one of the nuances I have with my body mechanics is I do well with a wider stance. Like my hip mobility and strength is pretty good. So the way I adapt tends to be this, where like my back's not flexed, but I can get into these wider kind of lunge stances with my feet not getting turned. Like I am able to do this. I know for a lot of people, that's hard to do, okay? So the way I am functioning right now, you're gonna see me go into these kind of lunges, but my feet are pointed forward. If you're ever reaching a point where your hips are an extension, you can't control how your feet are oriented, then it's probably gonna put you at a mechanical disadvantage, and you should raise the table a little bit. I think we had two things, like it was like a raise a table, lower a table, right? You really gotta just play with that over the next like weeks, months, for forever. Hydraulic tables for everyone, right? If you're watching these little shuffles, these glides maybe are an inch or two in their excursion length, and then I take a little step. And you get to the point where you can make that all feel seamless. But the way you save your shoulders and you keep yourself from being fatigued is making a shuffle graceful. All right. rotating. I'll doubt the angle on. No, you're not able to see that. That's okay. Here. There's some subtle actions that just happen in between applications that you kind of will ideally just naturally stumble upon, so that there's some kind of a sense of transition from one to the other. Okay, make a nice fist, good and strong, and slowly open, nice and easy. Good. Now I did that one too quick. I have to do one more of those. Fist, and strong, hold, hold. And then now, slowly open. And good. Okay, open here. None of this has to take forever. Like if we're just really thorough and efficient and make sure that when we're doing applications, we're getting more than just one thing done, like you can get through stuff much more quickly. Now, shouldery stuff. I have to determine if I think I'm gonna do something a bit targeted here. To start, what I would tell you to usually do is stay with your routine, and either at the end of working in kind of like a regional set, like for me, kind of working on the upper body and prone has its own pattern, and then I'm here for the lower body. So do the routine, don't let it disrupt your normal pace and rhythm, then come back to the thing. You could go so far as to just do the whole routine and prone as you normally would, and then come back to a specific thing. So what I'm going to do is I'm going to stop halfway through prone, do a targeted thing for shoulder, and then I'm going to stop at the last half and do an extra thing for low back. And these will just be some of the best ones I can ever show you to try to do. So this is going to be one of the most common areas, upper traplevator scap. You have got to, starting out, make sure you start engaging with people so you can clarify that you're getting onto the right, because you'll feel stuff, like something that's kind of like a notch or a speed bump or something, a ropey something. You'll feel it. You need to confirm with them so that you build that confidence that what you're on does feel like something important. And I keep it that vague. I use I found something ropey and I know where things attach, and I'll go, does that feel like part of the issue there? Something important there? Yeah. Okay, more pressure, less? Okay, right there. Now do I need to, now I'm gonna also direct a little bit. Now sometimes you could even have a person point, he can't assist. Now I can go, I'm gonna be drawing a little bit of an X pattern or a plus sign. I'm gonna go, is it more there, more there, more there, more there? Right there? Okay. You need their feedback. You can all know what it means to be kind of really close to being on exactly the spot at the right pressure, but you need that immediate feedback. Don't just guess. Ask, like, is it more there, more there? It might be a little bit of all of it. Now, and I would say, okay, give me a little shoulder shrug. Okay, hold it. When I do any of this kind of stuff, this active movement piece, coupled with inhibitory pressure, and slowly relax, I should feel what I'm pushing on change shape, because that's what muscles do. So if I don't feel the tone increase on the thing I'm pushing on, I don't think I'm having them do the right movement. Okay, push. And then pick a different movement. Could be lift their arm up off the table, stuff like that. Could be adventurous, but relax. You should always feel, if you're incorporating muscle energy techniques with inhibitory pressure, what you're pushing on, nearly always, you should feel an increase in tone when they do the action. Again, push. Okay, hold it, big deep breath, deep breath. And all the way out, slowly let go, slowly let go. targeted thing. That took probably an extra minute, something like that, and then done. Don't overwork an area. Work on it a little bit, leave it alone, let it breathe, come back to it later. That's how you can make somebody sore, is if you take the, let's say, 10 minutes of targeted work on a region, or a symptomatic region. Don't do the 10 minutes all at once. Do 3.3 a couple of times. Here's where some oscillation and shaking and joint movement. And this is especially good for anything related to lymph. So swelling related to either joint dysfunction or edema, all that. Now he's not swollen, but right here, this amazing action. One of the most valuable lymphatic techniques I can show you. Just rhythmic oscillation. I'm kind of just grabbing a hold of the hamstrings. I want to feel like I'm taking those muscles and just making them slip and slide back and forth over the bone. Now, rhythmic oscillation, regardless of how it's done, there's a variety of ways we can get creative with this, right? Now, it's hard work on you. There's no way to do rhythmic oscillation on a person's body without you using just your arm strength. So really the answer to how long you do it is as long as you can without it being exhausting. But look at that calf muscle. It's doing a good job. Now that's creating shear forces between all those layers, all the way down to the bone. And sneakily, we're getting a lot of extra joint stuff. Now we're getting an level of rhythm and oscillation that's like going through the whole body. But specifically, we're getting little oscillations at the hip, and then as I bring that knee flexion back and forth, these rhythmic applications are one, good at relaxing a person, but regionally they do the same thing. There's an element of, if you do a very constant rhythmic application long enough, the body usually will go, first it has to go, is this gonna hurt me? All right, this is different. Okay, I'm bored, and I give up. It stops registering as anything to try to stop, and it becomes a little bit more willing to just, for lack of a better analogy, go with the flow. Some of it is hypersensitization, where we're throwing a lot of movement-related sensory impulses into the tissue. So what we ideally get these muscles to do is some kind of reset. The reasons for some of this stuff get messy. And I've heard lots of very fancy terms as to why does rhythmic oscillation help with muscle tone? And there's a variety of reasons. Probably a lot of the slip and slide, distributing lubricating fluids between layers so things can slip and slide more efficiently. But then there's also that sensory nerve thing where we do this long enough and it's enough sensation to where eventually the body just kind of gives up and goes blah. And it's not the perfect explanation. There's more technical ways of explaining it. But for muscle tone, tight hamstrings, you push on them and they hurt. A person flinches, they go into spasms, stuff like that. Best thing to do for somebody like that where they're just really tonic and you can't push on anything because it keeps on hurting, is to shake it. Shake it until it gives up, or until you give up. For fluid movement, look at what I would, if this was a swollen foot, look at the downhill gravity effect I've created here. And then what the body uses to move venous blood and lymphatic fluid is the changes of shape of muscle tissue and the pressure changes in your joints. So what am I doing? I'm replicating the normal action that the body does. So you'll hear Sandy and I say mimic normal, mimic normal. So if I know venous blood and lymphatic fluid is usually conducted back to the core more easily out of gravity, done, and by changing the shape of muscles and by pumping joints. So this probably could be the most valuable lymphatic drain protocol I could think to show you, aside from some of the actual moving the skin stuff. But in real talk, and you just kind of cutting to the chase on that stuff in particular, I would do more of that stuff and apply kinesio tape. That's what I think would have the most validity for doing a lymphatic drain for a person. All right. Quick blah. Hips. Let's talk for just a moment on the anatomy of all of this. What we're targeting. Come here. Come out of there. Come here. You come here. All the way out. Okay. Gluteus maximus. And then lower the deep lateral hip rotators. Okay? The deep lateral hip rotators all attach onto, and it's hard to see, they all attach onto the greater trochanter. So this muscle is essential for core stability and hip extension. So if your glutes aren't firing right, you're not going to be able to stand upright and walk appropriately, let alone run. So we have to be able to work on this. Perception-wise for people, we got to find a way to work on this important muscle without them being weird about it, right? So that's where incorporating the forearm and the active and the passive movement of the hip or passive movement of the hip is so helpful. But then the next parts of the application are going to be, how do I affect not even just those? There's also gluteus medius and a bit more deep and anterior gluteus minimus. So there's 3 glutes. This is the big one. This is the one you'll be mostly working on in the first set of applications. But then there's another one that's a bit more lateral. And then there's these, which are more inferior or lower and deep. So I have 3 main areas I want to try to target here. Now, for some people, with even this, I can think, is it more about something related to the sacrum? So SI joint related dysfunction. Maybe I need my forces to be closer to the attachments here, as opposed to it being like a hip arthritis thing. So there's some modifications I even would make where with my point of contact would be more focused here, more focused here, more focused here, more focused here. And then there's all the spots in between those areas as well. You down, don't you go anywhere. Okay. What that will look like is forces that go here, then lateral. Now for him, that's where that port is, so I have to watch out for that. So here, lateral, and then inferior. There's the greater trochanter. Here's the iliac crest. So right there in between would be on gluteus maximus. If I can get my arm more lateral, then I'll get some of gluteus medius. And then if I can get my arm oriented in such a way and push deeper, just posterior to the greater trochanter, I'll get on those deep lateral hip rotators. And then I can start working my way more precisely through those if I identify that they're part of the problem. The most famous one of those is piriformis and how it relates to sciatica. All right, my positioning here. Get myself set. We talked a little bit about this, but I try to set myself so that my pressure is pulling the glutes away from the low back. So that's why I'm not standing like this, but my nose is pointed towards the opposite knee. So that means the glutes are getting pushed in that direction, or gluteus maximus is. And then these don't have to be big actions. Little rotations. I'm judging how much rotation. We ideally should have at least 45 and at least 45. He's a little stuck, a little hypomobile in both. So now I just switched. So if you see how now I'm more lateral, increase my elbow angle. So I was like this, and I went. And then if I want to be able to get more lateral, I could use that joint movement to my advantage. I just steer their leg that way. That'll turn their hip up towards me. And now I'm actually even a little bit more lateral. And then I just do this, much joint movement. Okay. Now we're going to get on the deep lateral hip rotators. I turn my arm down. Sometimes I rest my hand right on their hamstrings. because I'm going to place my forearm basically in line with the femur. Now, just below my forearm, or more on the lateral side of the body, I feel that trochanter. I turn the leg this way into external rotation, that trochanter roll up into me. So that can help me identify them in the right place. But then what will usually be your best practice is to let the leg go this way into internal rotation, because that will open that space. You won't be pushing on the greater trochanter as much, and you're doing a little bit of what's called a pin and stretch on those deep lateral hip rotators. Not everybody falls into the pattern, but as we discussed before you got on the table, most people related to the hips and shoulders, if they get distorted in a way that's not usually ideal, that the hips get stuck in external rotation, and we need to help them get more internal rotation. The shoulders get stuck in internal rotation and need more external rotation. Now that usually means I need to help a person not be duck-footed, turn them more into a pigeon, and for the shoulders, less, hunchy, gremlin-y, and more open. All right, so here, note that the rocking is not gentle. I'm just rocking the hamstrings, the whole body is being affected. And I'm feeling partly for how well those slip and slide, and they're doing okay. Those are moving okay. The calf muscles, the gastrocnemius and then soleus, which are the main ones that become the Achilles. There's another one underneath that called plantaris, but the big one that you see, the big surface one, that's gastrocnemius. I'm making sure it doesn't feel like it's glued to something underneath. Meaning I just feel like I can lift it a little bit. And yeah, all right, that's not too bad. I'll still massage there, but nothing alarming. Let's just keep that all happy and healthy. Here we've discussed if I'm going to use sideline, then I need to try not to worry about working on all the hamstrings. I'm going to be able to work on most of them much better in sideline. So in this position, I'm worried about just the lateral and inferior portion of the hamstrings. That means the outside by the IT band and the stuff closer to the knee. I will only do a few applications here, make sure that they're doing good and will continue to do well. And then I'm going to switch, do the same thing for these calf muscles. So gastrocnemius, again, I'm going to be able to work on the rest of these structures very easily in sideline. So I'm only worried about this lateral half of it. A little bit easier to knead here. This is a perfect case where I can get a good hold. What I'm feeling for when I do a knead like this is this hand gathers the tissue enough so that when I use this hand for a compression, I'm almost creating a lift and a counter force. But I'm not trying to force that torsion. Gather. This is how I do it. You can find your own hacks. Your elbows and wrists should stay nice and straight. And the force should feel like you're mostly focusing and worrying about how does the mechanics related to the push hand feel. The push hand should be the same as you use for compression or a glide. So I just added this. Hold it nice and stable with a good strong sloth claw. I'm not curling and pinching. And then switch. And I can even just do that all the way down. So this is how I'll do kneads. I don't keep gliding along and I don't force it through. Short, small, rhythmic. Okay. In my routine, I don't even worry about the feet in prone. if I had to, we've talked about a little bit about how to do that, but I'll show some of it. It can be important. All right, shaking. I don't necessarily do a lot of this, like I wouldn't have gone through that whole oscillation routine with every client. But I'm feeling, and stuff is a bit, and there's a difference here, so that tells me something. I have to be aware where that port is, making sure I'm not getting that. That's not part of it. It's going to be more of the rotators. So I'm finding those. It'll get easier for you as time goes on. That's the one I can tell tone-wise is more the issue. Now I could just passively do this and try to encourage the action, or I can say to the client, you feel this movement I'm doing here at the hip? I'm going to have you do the same thing. So just go ahead and rotate in one direction and just hold it. Yep, hold. And slowly relax and go the other way. Push this way. Yep. Keep coming, keep coming. Good, relax. Okay, go to the inside, that way. Okay, switch, other way. Keep coming, keep coming. Good, relax. And I got a little bit more. So I take that victory and I run away. Don't overwork the area. Here, throwing some of those long, swoopy strokes in. Get myself standing in the right position. So if I'm going to want to apply pressure there, then I need to kind of step away from it. Don't want to be here. Here. That was one. We'll do one more good one. And switch. That's how like no contact can be broken. I have a small nuance here. It's not anything that's essential, but just letting my arm rest on their hamstring. Again, this is a lot about me squaring my shoulders up, but I'm supporting the medial knee. That way they don't twist too much on me. So I just set my arm there. Starting out, you need to worry way more about your push arm and push hand. But over time, it can be exceedingly helpful to figure out how to get your other arm into positions where it helps square you up and or stabilizes their body to make the applications both easier and more effective. Okay, switching to kneading. Reset, again, switch. Trying to show just doing it with one hand so you're not having to always do that foot swapping. And good. If you are to work on the feet in prone, make sure that bolster is set where their toes ideally are clear from the table. The most challenging part is when somebody's shorter and their feet are all the way up here and you're reaching. And you're never gonna have a good mechanical advantage for that. The only thing I can say for that is sometimes pulling their leg over and then working cross table. You have to get creative. Here, I'm in a position where we can make this work. It's never gonna be my preferred. But little things, and you'll see this also in sideline, moving toes. I tend to move them all as one. I assume everybody's ticklish, okay? So 4 fingers, 4 toes, just grab them all at once. And I'm kind of doing a squeeze and a little just glide down. That'll flex the toes, kind of curl them, and I can just move them back and forth like that. Big toe can be grabbed by itself really easily. So around what we call the ball of the foot, which that's where just the first phalangeal joint of the first metatarsal is. So I can just, I wouldn't usually just do this, but I'm sure I could and it would feel okay. But if I couple that with applications at the heel, so I grab, not around the big toe itself, I'm more around what we think of as the ball of the foot. Then here, and it's gonna be like a knee. Just a small push-pull. Oh, there we go. Where the anatomy comes in handy is there's a tuberosity of the 5th metatarsal where your pinky toe ends. That has a larger element of its bony structure right here. And then there's a space in between it and the calcaneus, your heel bone, where there's extra muscles. So I'm not trying to be on that, I'm trying to be in between. And I can make that feel like a really good, foot ring. If we're gonna work directly on the arch of the foot, that's where we're at a disadvantage, where you have to get yourself crooked, and you're usually stuck having to then go downhill. Not my preferred, but if you're gonna pick something, it can be soft fist or a forearm, where you're gonna wanna support the toes so they don't get smashed into the table. Find the heel, find where the arch kind of starts, sink in good and strong. You can't have a lot of lotion, otherwise you're gonna slip out of control. And then just let yourself slowly, you really need to be able to control it so you don't slip, let yourself go downhill. Going downhill is not the best biomechanics. This is not the best thing to do, so it's either that or this. This is where like using the knuckles on the feet can feel good. It's gonna kind of have more of that targeted sensation. The only things you really want to watch out for with applying direct pressure is right there where the big toe joint starts. So you can feel it and find it, but you don't want to push directly there. Again, what people call the ball of the foot. But that's where that joint starts, and there's a couple extra little bones there that act like brackets between the tendons. You don't want to push on that, that will just hurt. You'll just be smashing tendons and bone, that's not good. And you probably wouldn't hurt anything, but it doesn't do a whole lot of good to apply direct pressure right here into the heel of the foot, because that's just layers of skin and fatty tissue. So you don't usually want to compress that. Think about what your foot's doing to itself all day long, right? It doesn't need more of that. We're doing enough of that. So the thing it needs more of is to be pulled away. So that's why I'm so big on squeezing. This wears down over time. So creating some space here can be a gift. The way to do that is this squeeze. And then I do the same thing here. This hand wraps around. I'm thinking mostly about that 5th metatarsal. And then I'm here. Now I'm reaching a little bit, but I'm not going to be applying a lot of force. Feels like I'm kind of, it's not like I'm really aggressively twisting the foot, but and what's nice about this, and the nuances of it, I'm creating a lot of cool effects from the tarsals into the metatarsals in 2 planes that are essential. So over on the other side, and that's what I usually do in this position to end things. So I'll just go here, Grab around all the foot and the heel. Get that all nice rhythmic squish back and forth. Come around, set my fingers around those toes. Give them a good bend back and forth. Wrap my hand around that fifth metatarsal, around the heel again. And I'm done.